The Department of Human Services has experienced a tumultuous few months. The agency's new commissioner, Jody Harpstead, appeared before a joint meeting of the Senate Human Services Committee.
I have had this granite plaque, which says trustworthy on it, on my desk and the desks of our 90 senior leaders at Lutheran Social Service for the 8 years that I've been CEO. Not facing out to tell the world that we're trustworthy, but facing in so that every email and every phone call builds that trust. We're at an exciting time in our nation's history as we all come to grips with caring for the huge aging baby boom, as well as others who need support to live in community. I've been working with DHS for the past 5 years to develop the Altair ACO for people with developmental disabilities in community services, and I remain committed to exploring new data-driven approaches that promise to lead to better health, fuller lives, and lower cost, in that order, for all Minnesotans. The theme of my 90-day plan is to rebuild the department in order to rebuild trust with the people of Minnesota. I'm counting on your support through the next 90 days.
There's a line. There's people who you get to hire that are appointed based upon who comes and goes at the top, and then there's a rank and file people who made this their career. And I agree with one thing you said on Almanac, that those individuals are really having a hard time. Some of them have reached out to us. Individuals have called us, and they talk about their interest in doing a good job, but their inability to actually report things that the OIG didn't care about taking their fraud complaints. Did not care. And like, oh my, that's the above the line people that didn't care about the below the line people.
I hope that you are empowered by the strength of the governor standing behind you to go in and execute, particularly the audits and the systematic review of how funds are handled. That has been, I think, the most problematic and troubling to Minnesotans over the last several months. I appreciate that you want to rebuild the department so you can rebuild trust. But there's something wrong when people are afraid of telling the truth. And so I'm so grateful that you have this list of priorities, but an employee culture where people are afraid is not going to lead to a productive agency.
I believe that I have a good track record, both at Medtronic and at Lutheran Social Service, of creating a good culture of trust, especially between above the line, below the line, the home office and the field, however people come to work, characterizing those kinds of sort of natural issues. And so I very much hope to bring that. We had a good conversation already yesterday with senior leaders about reaching to frontline employees in better ways to have communication and a conversation.
Who is going to pay the feds back? So we can't recover the fraud that had been in other areas, perhaps, but there is this lingering bill coming to Minnesotans from overpayments from the feds because of the billing that was suggested or guidance that was given to the tribal nations and other providers. And so the question is, who's going to pay for that? Mm-hmm. And how much are we talking about? How long has that overbilling been going on? And we know there's the way to stop it, but how long has it been going on? What's the total amount? And who's going to pay? Where's the money coming from?
Yeah, that's a very good question. I have the same question. I've just begun to get briefed on that issue, and I need to learn more about it. Of course, we're waiting for the review of the whole situation to really get the entire picture of it so that we know exactly what you're asking about, how far back, how much. And then the question is, what are the potential pathways going forward? I reached out yesterday to both the White Earth Tribe and the Leech Lake Tribe, and we had cordial conversations about how we all want to see this resolve in a way that's not harmful to the tribes. And I need to go and understand more thoroughly what possible pathways there are for us to reach that outcome, and I don't completely understand yet what's possible. And we'll want to be talking with all of you about that as we go forward.
Thank you. And one final comment.
Senator Nelson.
The taxpayers, yes, the tribes, but the taxpayers.
Yes, absolutely.
The taxpayers are on edge. They want to know.
I do have a wish list of a few things I just wanted to send you off with.
Thank you.
On topics like the 25 million and the 48 million, it seems, I believe you'll be changing this, but historically, the amount of information that has flowed out of DHS to us has been the smallest bit that can be given, it seems like. I raised 6 teenage sons, and what happens sometimes is they run into a curb or something and dent the fender, and so they park the car so you can't see it. But
I've had teenagers too.
But they never happen to anybody else here. But eventually you find out.
Joining me to offer his assessment of DHS as well as potential opportunities for agency reform is the chair of the Senate Human Services Reform Committee, Senator Jim Abeler. Thanks for being here.
Good to be here. Happy autumn.
Yes, happy autumn. As a policymaker, you certainly support efforts to combat addiction. In those efforts, the Department of Human Services used Medicaid dollars improperly and must now pay back the federal government $48 million. This is complex, but presumably DHS made these overpayments or misused these funds in good faith. So my question is the system just so complex? Is it human error? Is it both?
Yeah, I think they meant well, but I think they knew they were at risk in 2016 with these payments to facilities. And the question isn't, do we overpay the providers? The providers got the rate they were supposed to get. And so the question was, does Minnesota pay all of it, or do they pay half and the feds pay half? Anything coming from Washington is free money, by the way. So we always try to maximize that so other taxpayers can pay for Minnesota stuff. And so they kind of got caught. In May, the Fed said, not paying anything. By the way, we're going back a couple of years and send us a check, please. So it's a big problem. We actually did fix it going forward, but this $48 million in a budget of $38 billion, it's still real money, and it's a big problem, and we'll be discussing a lot about that in the upcoming months.
Is it likely, though, that these kinds of misuse of funds inadvertently will be ongoing just because this money's earmarked for this and can be used this way, and this money's earmarked for that and can be used that way, and there's just so much complexity around it?
It's really complicated. This could be used for actuary class if you wanted to have people get tutored on complexity. It will continue, but some things we should know better about, and they didn't really tell us that it might actually happen. So that was part of the issue, like, could you please tell us? And then we won't read it in the paper, or you get a call from a reporter. So that's the ongoing issue about communication. Which
was mentioned in the hearing today.
Yeah.
There's another headline in the news about the $25 million that in money that was paid to tribal leaders for the purpose of substance abuse treatment. The tribal leaders have documented that they applied for the reimbursements as instructed by DHS. That's what the Pioneer Press reported. Should they be required to pay back the state?
Well, they asked and they asked. I think no less than 4 agencies. Is this really okay? Yeah, we're good. Or you're good, go ahead. And so I don't think they should be asked to pay it back. They're not going to ask the $48 million substance abuse people to pay back their money that they rightfully thought they had coming from the state, and I think in the same way in the tribes, to be fair. Not that that's any small amount of money. $73 million is a lot of money. But the department needs to be more careful, and I'm kind of optimistic with the new commissioner coming in that she's going to try to create a better discussion, and it's time. And so we'll talk about that maybe, but I wish her a lot of success in that.
And what you would like to see is just more transparency in the agency, as was mentioned today. If there's a problem, just let the legislature, let the Senate know there's a problem so that you can be forewarned.
Well, and we're some kind of a partnership, not a very good one. So DHS does what they want and tries to tell us what we need to know to get by. But a true partnership will help it be stronger. We'll have better programming, better buy-in. Stakeholders talk to us, they talk to them, and it'll be good.
Commissioner Harpstead referenced this in her comments today, the aging baby boomer wave and what that potential impact is on Health and Human Services. We have the state demographer also on the program this week, and she said that Minnesota just passed a benchmark in that its 65 and older population is now more than our school children population. Education, human services, biggest parts of our state budget. As we move forward, how fierce is the competition for dollars going to be?
You just described me. I turned 65 this year, and we have no school-age kids anymore. We used to have 6. It's going to be a big deal. Not only that, there's fewer people paying into the programs to support the elderly, Social Security, and even Minnesota programs. The tax base is aging. So it's going to be huge. And so you'll have education people fighting with long-term care people about health care, and good luck if you care about clean water or roads or other things. So it's going to be really difficult. And so part of that is the seniors need to find a way to take better care of themselves and be more like the ant instead of the grasshopper and rely on magic government to take care of you. So at the end, you know, Jesse Ventura talked about personal responsibility. That hasn't changed. And if you just turned 65, you better make some plans about looking after yourself.
And eating well and exercising.
Eat your carrots and call your mom. Yeah.
One item on the agenda today that took quite a lot of time at the meeting was the procurement process review of the Prepaid Medical Assistance Program, or PMAP. There was a recent court decision that prompted DHS to cancel its request for proposals for next year. DHS is complex, but for the average viewer, what's the gist of what's going on? What do people need to know about this?
Well, we have many groups that help provide health care. Amongst those are counties that band together to make a county-based purchasing group. They're extremely effective, and they have every reason to conserve the money because it's their taxpayers are backing it, but they also care about the people. And they want to wrap other county programs in together to serve the people. And the department just did not listen to the concerns. And the court case actually saved the day for not shutting down Itasca and South Country that have been around for over 20 years, and they're doing great work. And so we're going to slow down, and if my optimism about Commissioner Harpstead is properly founded, there'll be better listening going on and a better discussion with the counties. How shall we serve our individuals? And you have to be an optimist around here because it's almost always raining. But the sun will come out, and it's going to be coming soon, I can see.
And the idea behind this, though, is that the local areas have a better take on what their people need versus a state agency sort of one-size-fits-all. Is that kind of the gist behind this?
Or even a health plan centered in Egan or Minneapolis, someplace, deciding what should happen in Wabash or Koochiching County or somewhere.
Okay. One last thing before we go. Former acting commissioner of DHS, Pam Wheelock, acknowledged that the Department of Human Services should be broken up. Other lawmakers are weighing in on breaking up this huge agency. I'd like your take.
Well, and it's DHS, it's not the size that matters, it's the function. And former Representative Paul Thiessen and I, 8 years ago, talked about how we could do it, different models. But so DHS has 7,000 employees, which doesn't matter how many there are, but they're regulators, they provide service, and they investigate themselves. In my opinion, the people doing the service should be doing the service with the sex offenders and all the care for people with disabilities. And the regulators should oversee them. And it's not even fair to the state employees, the AFSCME and MAPE individuals and others who are working there to be overseen by their contemporaries. And if there's something wrong, the Inspector General shouldn't be in the same group, because then the commissioner could say, don't investigate that, which, by the way, happened. And so a lot of fraud, a lot of issues, and the legislative auditor went into some detail about how investigations aren't happening. And even whistleblowing individuals have called me since the hearings. When they report things to the Inspector General, nothing happens. And so it's time. There's a discussion. The governor's open to it. Paul Gazelka is. I'm sure Representative Hortman is. We're going to find a good way to get this to be serving Minnesota well.
Senator Jim Abeler, it's always a pleasure. Thank you.
Thank you.